When addressing erectile dysfunction, it's important to approach treatment and lifestyle changes carefully and avoid common mistakes that can make the condition worse or delay effective treatment. Remember this, ED is manageable and in most cases treatable, but you have to do the following things. Viagra is not the solution, it is punctual, and you cannot rely on it for a long term. You may say, you already heard this before, but listen, as long as you will keep ignoring these 8 things I am about to tell you, no medication, no ingredient, and no exercise will help fix your erectile dysfunction. Nothing, especially if there is an underlying condition. But before I say any more, I have a special gift for you at the end, so stay with me. Now, the mistake most men make is trying to find the magic drug or ingredient. Well, it doesn't exist. No medication can guarantee a long-term erectile function. However, the list of do's and don'ts I'm going to give you below will do. I'm a doctor, and believe me, I know what I'm talking about. Guess what? You have everything you need to solve the problem. You're just not using the right methodology. Because remember, erectile function is highly dependent on your mental health, your ability to control your emotions during intercourse, and the strength of your pelvic floor muscles. As you can imagine, you can control these 3 things I just mentioned without any medication. And even if there are underlying conditions, that's not the end of the world. That's where medicine can help control and then restore completely normal erectile function. Now, here's what you should not do. 1. Don't self-medicate without a doctor. Stop taking continuously Viagra, Cialis, and others, especially since most of them are counterfeit or unsafe. ED can be a symptom of serious underlying heart disease, diabetes, high blood pressure, etc. So doctor assistance is key. 2. Don't ignore psychological factors. Practice several calmness techniques out there to manage anxiety, stress, and depression. If needed, consult professionals. Good mental health is a real and critical factor in sexual performance. 3. Don't overuse porn or masturbation. Excessive porn use can desensitize your brain to real-life sexual stimulation, sometimes called porn-induced ED. Excessive masturbation can also lead to performance anxiety or reduced sensitivity. 4. Don't ignore exercises including Kegel. Cardio, general exercises, diet, and sleep provide long-term improvement, including healthy blood circulation. Kegel exercise gives a specific benefit on the pelvic floor. Don't hide it from your spouse. Keeping it secret can lead to shame, relationship tension, and more anxiety. Open communication reduces pressure and helps partners work through it together. 6. Don't ignore lifestyle triggers. Smoking, alcohol, drug use, poor diet, and inactivity directly impact blood flow and hormone levels. Ignoring these factors can sabotage other treatments. 7. Don't expect instant results. Reversing ED, especially when related to health or psychological issues, takes time. Be patient with treatments, therapies, or lifestyle changes. 8. Don't be embarrassed to seek help. Many men delay seeing a doctor out of embarrassment, missing a chance to treat not just ED, but serious health risks. Most importantly, don't hide the issue, self-diagnose, or rely only on short-term fixes. Believe me, only when you avoid these 8 things will you be able to lay the foundation for good erectile function. I know you'd like me to list the medications and ingredients to take, and I will do it in the next episode. But as long as you don't practice what I just said, no medication or ingredient will help you in the long term. Now, a gift to you who have stayed until now. By far the most common erectile dysfunction is premature ejaculation. What's the technique to overcome it? During intimate act, do these 3 things simultaneously if necessary. 1. Defocus. 2. Strategic out or slow. 3. Diversification. Defocus. When you feel the pressure building and you feel it coming, intentionally direct your thoughts towards something else, something boring. A class homework, what you'll do tomorrow at work, a noise outside, etc. It's possible. You can do it. With a little practice, you'll get there. Strategic exits or interruptions. Stop the in and outs as often as necessary. Diversification. While you're out, cuddle your wife and do other things to keep her engaged. That's it for today's gift. Visit dysfunction.com for more advices.